Welcome to Dr. John's Mythbuster. Ooh. Okay, so what are we myth-busting today?
Blepharoplasty.
Blepharoplasty. Great.
Ready?
Yes.
There is only one type of blepharoplasty.
No, there are several types of blepharoplasty. Other than the area, so upper lower, there's also transconjunctival, where you do it from the inside of the eye rather than the outside of the eye.
Blepharoplasty stops the aging process.
No, I wish we knew how to stop the aging process. That would be great. What it does, though, it does rejuvenate your eyes by taking off that extra skin that has been growing there for several years, and it usually lasts for about 12 to 15 years.
Blepharoplasty will result in a surprised or frozen look.
No, it doesn't do that. And so you take off the optimum amount of skin from the upper or lower eyelids, get rid of the puffiness, get rid of that extra skin, tighten up the muscles so that you have a more open eye, so you don't get that hooding, you don't get that weight over your eyes. That's what it gets rid of. If you want to get a surprised look or a frozen look, you do Botox on your forehead. And if you want to have the wide-eyed like this, then you just staple your eyes up to your eyebrows.
Male and female patients require the same approach for blepharoplasty.
The approach is pretty much the same. The amount of skin you're taking off depends, but usually males have more skin and their skin is thicker, so I will use a thicker suture when I'm suturing it up. And men usually tend to have more fat under the skin, so it's like different things you consider when you're going into it. But every patient is different as well.
Scarring is noticeable.
Scarring is actually very unnoticeable, and if you see my before and after photos, you'll notice that a lot of these patients don't even look like they've had surgery, and the reason is why. First of all, we hide the scars really well. Every surgery has a scar. And if you know what to look for, you can find it. What's going on is that for the upper eyelids, for the upper blepharoplasty, we hide it right in that natural crease. Sometimes it's a little bit above because we need to pull up the skin because it's hanging down lower. We need to balance things out. And for the lower eyelids, there's a little line right as close as possible to the eyelashes. That's where I will be cutting usually, and I hide it right in there. So when everything heals up, it looks like that natural line, and then for the same thing for the top, it looks like a really natural line. If you give it, if you give it 6 months and you're using the right treatment, like silicone gel for scars, and since we do a very good job in the actual procedure and make everything fine and hidden and everything like that, it should be very unnoticeable.
Blepharoplasty always removes dark circles under the eyes.
Unfortunately, it doesn't remove the dark circles under the eyes. It's the thing that a lot of people want to get rid of. If there is dark circles on the skin that we're removing, yes, it will get rid of some of it, but usually the dark circles come from other things. It could be a vitamin deficiency, it could be you're staying up late and things like that. It could be there's a lot of other things that will help to take care of that, but not a lower blepharoplasty.
Blepharoplasty treats upper eyelid and eyebrow hooding.
It will treat upper eyelid hooding, but not eyebrow hooding. If you want to lift your eyebrows, you got to do a brow lift, lateral or medial, depending on what you want to get. And the hooding basically is just that skin that's hanging off and covering up the corner of your eyes. And actually, it can get so bad that it can, you feel that heaviness and it makes you feel tired, but it also can block your peripheral vision.
Blepharoplasty is just a cosmetic procedure.
Well, no. I mean, it is technically a cosmetic procedure, but the fact is we're not doing it just for the look. Most of the patients that come in and they say, I feel tired, I look tired. As I said before, the skin hanging over your eyes can block out your peripheral vision. If it's hanging over the front of your eyes, it can just block your vision in general. In fact, I think that the NHS will actually perform a blepharoplasty on a patient if it's covering their eyes. So no, unfortunately it's not, or fortunately, it's not just a cosmetic procedure. Yeah. And that's it for busting the myth today. Next time we will be doing, what type of myth busting?
BBL.
BBL myth busting, so stay tuned.